What would you say to patients who may be hesitant to participate in a trial?
Yeah, I think, that's a great question. And I think many patients are at first hesitant to participate in a trial, which is natural. There's already so many overwhelming and scary decisions to be made when it comes to getting a breast cancer diagnosis or any cancer diagnosis, that to, introduce a whole other set of discussions and set of variables is found extremely overwhelming, and adds another sort of level of what might feel like uncertainty. So I think that's a completely natural response, is to be, hesitant and overwhelmed if somebody brings up a clinical trial. But what I would try to address in terms of patient concerns is what a number of things that I just laid out. Number one, I think that patients worry that if they are approached about a clinical trial, that means there aren't good other options available to them, which almost always, not always, but almost always is actually far from the truth. Usually it's just because we have a standard, we think it's pretty good, but we'd like to do better than the standard, and participating in a clinical trial is how we do that. So, first, I always, of course, try to assure patients this clinical trial is not like something we've never tested before and we know nothing about it. And it's not because I don't have other options for you. It's just because I want to do better than the existing options. And, often it's looking at an agent that's already FDA approved, but we're trying to combine it with a different agent or something like that. So, obviously, number one, try to, give patients some reassurance about what we already know about the trial agents, and also reassure them about the fact that, we don't anticipate that the efficacy of their treatment overall would be compromised. Rather, we're trying to improve upon that. So, I think that that's that's probably the most common concern that I hear from patients. But of course, as providers, it's our job to understand from that specific patient who's in front of you, well, what are your particular concerns about clinical trials in general? And, are those sort of misconceptions that I can dispel for you? Or, are they real things that some women on trials do experience, in which case, we should talk through them and decide if it's the right fit for you. It's almost always true that participating in a clinical trial does come with, what I always call a few other hoops to jump through, because when you're participating in a clinical trial, we want to learn from your experience. And so often, we do want women to, complete questionnaires about their side effects, or, have a second appointment 1 week later so that we can do an extra side effect check-in or something like that, do an EKG that they wouldn't otherwise need. So, there can be and often are some additional sort of logistical or scheduling components that come with participation in a trial. And, again, we would want a patient to voice how that might or might not fit into her life, and be very upfront about what could be expected in terms of additional asks, which can be extremely minimal or sometimes more disruptive depending on the trial. So obviously, we just need to have a conversation about that.